The U.S. has seen a massive rise in childhood obesity rates. According to the CDC, today, more than 1 in 5 American children are obese. That is up from 1 in 20 back in the 1970s. Here to react is Fox News medical contributor and author of the book, The Miracles Among Us, Dr. Marc Siegel. Hey, Dr. Siegel.
Great to see you again.
Good to see you, too. Why the contrast? Why are we seeing so many more children obese now compared to the 70s?
Because kids, 60% of their diet is ultra-processed foods. America, what are you having for breakfast this morning? Are you having fruit? Are you having whole yogurt that has probiotics in it that actually helps your gut to be healthier? What are people eating? And the problem is that manufacturers sneak in stuff that keeps things longer on the shelves, that they can last longer, more of a profit, more addictive. Kids see stuff that's brightly colored, a cereal that's brightly colored, loaded with artificial ingredients, high fructose corn syrup. Sugar is addictive. All this bad food is addictive. The thrust now with MAHA is to replace it with whole foods, to replace it with fruits and vegetables, to replace it with dairy again. I agree with all of that. Bring back healthy fats instead of unhealthy sugars and salts that are addictive.
Yeah, we were talking during the break because I said, well, we had those sugary cereals in the 70s when I was growing up, too. But you say the companies have changed the additives.
Well, the cover may look the same, but the content, what's inside, is not the same. It's not healthy.
Well, if you break down, out of the kids who are obese, 15% are overweight, 21% of those are considered obese, and 7% severely obese. And MAHA has linked, these are the factors: diets high in ultra-processed foods, environmental chemicals, low physical activity, and more screen time. That has to be a big reason.
And a lot of this got worse during the pandemic. We need to bring back physical education classes. We need to do less screen time. I mean, Australia's banning the use of social media for people under the age of 18. We have to consider that, but we have to consider getting people to interact more. That's another thing. Get the school lunches back and make them about whole foods. MAHA is going to authorize 9 states now to bring free school lunches. All states in the country should have free school lunches.
How do we talk to our children if they are obese? How do we talk to them about eating healthy and without giving them a complex or without hurting their feelings?
I think we have to start by putting the right food on the table. All food is addictive. If you see an apple on the table in the morning, maybe you're more likely to eat it. I think also kids will eat what we eat. So if we're eating healthier, they're going to eat healthier. That's another idea. The other thing we have to do is teach medical professionals. Hooray for Kennedy now saying that 40 hours in medical schools have to be towards nutrition. We already did that for opioids, for pain. We say 40 hours for pain. In other words, you got to learn how to control pain. If you're a doctor now, you got to learn about nutrition. Doctors are taught how to treat illness, not how to prevent it.
That's good.
Nutrition's how to prevent it.
Also, there have been some studies. Should we put obese children on these GLP-1 medications like an Ozempic?
Well, I think that they're a tool in the quiver, an arrow in our quiver, but they should be withheld to when you really need it, to really severe cases. Because remember, as an internist, I'm seeing high blood pressure, I'm seeing heart disease, I'm seeing diabetes and cancer that comes because people are obese over a lifetime. I want to stop it very early, but I don't want to rush to these drugs. I want to do it by lifestyle. We already said exercise, better diet. What are your parents eating? What are you eating? What are you eating in schools? Those are the things. That's where we have to start.
Yep. All right. Thank you so much, Dr. Siegel.
What are you eating today? What are you eating this morning for breakfast? I know Ainsley ate healthy. What did you have?
Thanks, Dr. Siegel. His new book is called The Miracles Among Us. It's great. It's available now if you want to pick it up. And we will be right back.
I'm Steve Ducey.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.